I've been working as a paramedic for about 6 months now. Twice I've encountered patients who need emergency care and that are actually sign language users. We do not have any way of communicating with them. With any other language, I can call up language line, I can get an interpreter. But for British Sign Language, which is a recognised language in the UK, there's nothing. My name's Daniel Hunt. I've just finished my studies at UWE Paramedic Science and I got a first. I set up the UWE British Sign Language Society. As I'd already been learning sign language for a number of years, I just wanted to help other students access sign language and start learning. But alongside that, we also were able to run deaf awareness workshops and CPD events for healthcare students. I started connecting with people from the deaf community and they found out that actually I was training to be a paramedic. I started to find out about their stories and their experiences of accessing, well, more the difficulty of accessing healthcare in general. We have a real obligation to get informed consent. When we're treating people, they understand what's happening, they understand what's wrong with them and why we need to take them to hospital. If we can't communicate that information to them, we're doing them a disservice. I contacted the Centre for Deaf and Hard of Hearing People, who are a local deaf organisation, and they were fantastic. And I actually think one of the reasons why this was so successful is because it was deaf-led. We were able to offer this training to over 350 students. Once UWE saw how popular and successful it was and how much of an impact it was having, they got behind it and they've actually now integrated that into the paramedic curriculum. And now we're looking actually to expand that further and roll that out to midwifery students and optometry.
My name's Mark Gill and I'm the Community Development Officer at the Centre for Deaf and Hard of Hearing People. Really, it was down to Dan's passion and commitment to wanting to see more deaf awareness in the course and the benefit that would have with the students, and his understanding that deaf people face barriers in their lives and the frustration that comes along with that, and that is due to a lack of deaf awareness and a lack of training in deaf awareness. On behalf of the deaf and hard of hearing community, I want to thank you, Dan, for your dedication, your passion to improving the lives of deaf and hard of hearing people in healthcare settings. I really want to just say a huge congratulations on graduating.
I feel enormously proud and I'm just really happy that this is going to continue, and I'm hoping to continue working with UWE and hopefully keep expanding this project.